Hello viewers, welcome to Minecare Positive Life series. Today's episode is dedicated to World Asthma Day. With the change in environment, with the change in lifestyle, there is an increasing incidence of asthma worldwide. A World Health Organization report mentions India having more than 15 to 20 million people affected with asthma. We do not know for sure the right number, but it makes sense for us to investigate with a series of doctors who are specialists on what are the cases at hand. We'll try to know about asthma, the preventive aspects, and much more details so that we become informative and we can take better care of ourselves. Dr. Garg, thank you for your time.
My pleasure.
Before we get into the discussion on asthma, let me touch upon your specialty area of respiratory and sleep. Why don't you give us a brief background of what are the areas you look into?
So we look at basically diseases of the lung and of the respiratory system, and one of the other things that I've sort of added to the specialty is sleep medicine. So this is a completely new field of medicine. I mean, it's not a new disease pattern. People have had this sleep disorders for long as you can think. But it's now our focus. Medicine has always been typically about waking up and problems with them. We've never thought about sleep because we thought it to be a very passive process. Now we understand it's an active process. So therefore, it has come into limelight. So that's a new field that is my passion as well.
So you are looking more into the apnea part of...
Just not apnea, yes, of course, that is the bread and butter and the sort of engine of the specialty. But there are so many other sleep problems that people have. Insomnia, one of the most common, people just not getting sleep, just not having the right sort of set for the sleep-wake pattern. We've got an epidemic of, I think, sleep deprivation. People work here. They've not just so that focus on sleep. So is not there. As a society, I think that's what is missing, and I think that's creating a lot of problems.
Doctor, briefly for our audience, what are respiratory disorders?
So, if we talk about the respiratory disorders, the most common disorder I think the people know is as asthma. Then one of the other most common and the most sort of important problem is the COPD, which is very similar to asthma and sort of the disease of the smokers, and that you're seeing more and more of it. It is now the 6th largest killer. Very soon it will be the 3rd largest killer.
Okay.
The other diseases are lung cancer, tuberculosis. We've still got a big pool of tuberculosis. We no matter where you're practicing, you end up seeing a lot of complex tuberculosis patients. The lung cancers is one sort of area where we've achieved little success. We're still seeing terminal stage lung cancers, late diagnosis, and not much progress in treatment. So these are basically the areas that we have a whole lot of other, bronchiectasis, smoking related problems, the environment related problems. So it's a broad specialty. But one of the things I must mention here, you've heard about cardiologists and the big cardiologists running hospitals, and they've done really well. But if you today go to a hospital and say, I've got breathlessness, there's very likelihood that you're going to be admitted under cardiology. So the focus, I think, is in the society, we are like the 3rd or the 4th in terms of absolute numbers, in terms of where the disease profile stands and the WHO feels. But as a specialty, especially in this country, we've not grown to the extent where people understand that there's a need to see a pulmonologist or they will. So I think that's one of the areas that we need to address.
In fact, World Health Organization report was pointing that there is anything between 100 to 150 million people who are suffering from asthma.
And as a percentage of the total morbidity and mortality, if you look at the respiratory diseases, whenever they come of total mortality or the total morbidity in the general population, respiratory diseases are one of the top 3 or the top 5 problems. But if you look at the proportional representation in the healthcare of the respiratory departments or the respiratory physicians, it's a very, very small number.
Doctor, is it related to the lack of information with the people, or is it a process which is wrong? I mean, if somebody has a breathing problem, it might be related to the heart, it might be related to the lungs as well.
But I think cardiologists done a good job trying to create that awareness, and I think people do understand if there is a problem, they'll go and see a cardiologist. we've still to cover that journey. And there are other reasons as well, how the training is I think has been scheduled in India. We still don't have a sort of, the All India Institute, you wouldn't believe, has just started the DM in respiratory, but this was 2 years back. This is the first ever course by the All India Institute.
Right.
And they just have a separate department of pulmonology only 2 years back. So these are things which impact, the way the specialty is practiced in the country. But I'm sure we've started this journey. There's more and more focus on it. A lot of young, bright doctors are taking it up. And I think we've got a long course, but
right.
yeah, we've started.
Doctor, World Health Organization says that around 15 to 20 million people in India are suffering from asthma. So what exactly is asthma?
Okay, so I think the number is still in underestimation. We've probably more. So asthma is basically this episodic, to put it in a layman word, is this episodic disease where there is breathlessness, there is wheezing, and there may also be cough. What happens in the layman will just correlate, I don't have breathlessness, therefore I will not have asthma. I think that is a very wrong perception and a myth. It may just present as cough. So, and more people are presenting with this chronic cough, which is episodic.
Mm-hmm.
So, two things they should understand: it is sort of related some way to the weather. Most of it, when there is a change in weather. So, if you have a disease which is you kind of have it early in your childhood or adulthood, which is episodic in nature, may or may not give you breathlessness, give you wheezing, may be associated with sneezing, a lot of allergic symptoms. So that's typically asthma for in a lame line.
So doctor, what are the causes of asthma? There would be some intrinsic and extrinsic factors. So if you could highlight on those.
So as you see and the attention being put on the environment. So this is one big reason why the so highly polluted environment that I think especially of the NCR, and I'm very glad at least now we've been able to bring some focus. Different governments I don't think they've got it, but they're at least trying to
right.
bring some sort of, so if you have that degree of allergic environment, that also contributes, and that's a very strong intrinsic, extrinsic. But having said that, some of the pristine and the most cleanest environments in the world have very high prevalence of asthma. So environment itself is just one bit of this complex. It is like any other chronic disease where different reasons, different pathways contribute to the problem.
Okay.
So if you look at UK, Australia, Midwest and the US, these are the hotbeds of asthma. So it is just not the cleanliness of the environment which is the sole factor. There's a lot strong genetic reason for it. How we've not been able to completely, we know there's a gene, Adam gene 23, but beyond it, I think it is not dictated by one particular gene pattern. Multiple gene patterns contribute to it. And there is also how, in the pregnancy, how the mothers feed. A lot of those things again, but these are all hypotheses. We don't have a clear understanding as to, there is an inheritance pattern, but there is not clear, so multiple reasons.
Doctor, you have practiced in the Western world as well as in India, and you've been practicing for a decade. Do you see any specific causes that happen in pristine environments and any specific causes to polluted environments in India?
Yeah. So this particular thing is called hygiene hypothesis. This is a well-established hypothesis, not absolute. So where they say if your body's immune system has got nothing to do and the environment is pristine, there are no parasitic infections, what your body's immune system goes is it just tends to fight against its own sort of intrinsic allergen. So it then goes from Th1 or to a Th2 response. So that, and therefore creates diseases like autoimmune diseases and asthma. So that's the reason, and we know for sure. And this is an explanation as to the high reason of asthma in these environments.
Right. Doctor, can asthma be hereditary in nature?
It is like diabetes, but there is no clear, we don't know if the father and the mother, and I get asked this question every day, is my son or my daughter, there is increased likelihood, that's all I can say, whether in what proportion would the kids, we don't have a autosomal dominant or autosomal recessive pattern, so yes, there is an increased risk of having asthma in the family.
So typically, how do people identify whether they're suffering from asthma or not?
Yeah. So the symptoms would typically start with young, you have these kids who will have breathlessness, episodes of breathlessness or cough. It's very hard in the early childhood to say whether the kid has asthma. They have mostly, it is labeled as, they have small airways, anything in the airway, will cause breathlessness. So that's labeled as bronchiolitis, and it should not be. So as they grow up, many kids in their adolescence will grow out of asthma. Some will not. We don't exactly have a handle on who and who will not grow out of their asthma. So in India, typically people put it to homeopathy, or they went to Hyderabad and got a fish and therefore they grew it.
Yeah.
Actually, the reality is it is the play of these hormones and the adolescence which pulls them out of the asthmas. And then you have people who will have adulthood asthma. Now we are seeing a lot of late onset asthma as well. Now people who have late onset asthma, the ones who have had childhood asthma and then the asthma has come back for whatever reason in the late.
Right.
So, and the other thing is that if you will never have a patient of asthma saying last 20 years I've had the asthma for this severity. It has its own waxing and waning pattern that we again do not completely understand and completely dictate. All you can do is to take your medications well, understand your disease. They can increase your chances of having increased the disease-free intervals. And people put it, I went from Pune to Bangalore, my asthma improved, and I went back in this. So they'll correlate to one thing or the other, but the reality is that it is a disease which has a waxing, and that's the big challenge as well.
Okay.
Think about a chronic disease like diabetes. One day it is there and then the other day it's not there. So our patients, when they improve, so some then what we say is escape the net forever. We never see them back till they are so unwell that they have to come to us. So compliance becomes a big problem.
So doctor, I mean, as you say, there is no hold on a specific age bracket or specific demography of people who are more prone to asthma. Is there anything that have been found out?
So it's again a disease, as because it has a genetic component, inheritance. So in the younger age group. So it is very, one has to be careful to label a new asthmatic after the age of 40, they say. Right. But again, these are getting, with increasing level of pollution or environmental factors and whatever other reasons that we are seeing new and new asthmatics being labeled later in their age group. So right. Again, we don't completely have a very good scientific explanation why, because the kids, if they have atopy is this tendency of having increased sensitivity to different allergens. Right. So atopy will manifest with the baby having rashes or a lot of other allergic symptoms, and therefore have increased chance of having asthma. But there are other pathways as well which lead to this.
Doctor, interestingly, I'll come to the question on the kind of research worldwide which is happening in this particular area. I mean, we getting to know from you that there may be very many causes, and we're still not certain about the cause and the effect. Yeah. Now, from this point of view, would you highlight on the emotional stress and the linkage of it to asthma? There
is a clear relationship. Patients who are asthmatics, if they are undergoing any episode of stress, it triggers asthma. Again, you've seen this in Bollywood a lot of times that there is an emotional situation that and thanks to Bollywood, they've made our job very difficult in terms of how they portrayed the inhalers and their whole thing. I think that's one big grudge that we have with them. They made our task so difficult, and the sort of the myths they've created about the addiction to inhalers and that's all the reason that all the movies so far have made it's actually not true. Most of it what is portrayed in the movies.
Doctor, coming back to the research bit, I mean, what kind of research in various medical institutions are happening these days to unravel and understand asthma much better?
So I think we have research at different levels. One is the epidemiological research. So epidemiological research will tell you what is the prevalence in different areas and try and come up with an explanation, as I said, about clean environments. Why should they have a high prevalence of asthma? You can think about an environment like ours. So one is this level of the epidemiological research, which tells us about the disease patterns, the pockets, and why, and help us to correlate. One is the clinical research, and clinical research is today we understand that all patients of asthma are not one. We understand within these asthma patients there are these pleomorphism. One group of asthmatics behaving in a different pattern versus the others. You have 5% of these asthmatics now understand have brittle asthma. They'll be well for most of the years. They'll get unwell and they'll get admitted to hospital in the ICU on the ventilator. So, and their disease runs. So this is another subgroup. So right. At a clinical level, the research tells us how do we classify, whom do we best give what medications. So that is, and the third level is the molecular level, helps us to understand the changes in the airways which are going on and what is inducing those changes, and how can we ultimately reverse the modeling or the airway remodeling that is happening. And the fourth is the level of genetics.
Right.
And some of these countries like Finland, the smaller geographies, are taking the leads on those fronts. So these are the, I think, 4 fronts where.
Doctor, coming back to the treatment of the disease, what kind of treatment is available, and is it 100% curable?
It is treatable. So I'll tell you what my teacher told me about asthma. If you'll only get admitted for asthma if you're fat, mad, bad, or sad. Today, otherwise, there's no reason why asthma will put you in a hospital,
Right.
and that's very true. Unless you have a brittle disease.
So, what kind of treatment do we administer?
So the treatment of choice are the inhaled medications. It is not oral. It is not cough syrups. Unfortunately, every single day I see patients who've been treated with antibiotics and cough syrups by the general physicians for asthma for years before they end up coming to us and having a more severe disease pattern. I think, and that's also true with what patients like. They like cough syrups. They're okay to use, and they're still afraid of the inhaled medications. And they think about inhalers as something really the last resort, or something very strong, or something they'll get addicted to. So basically 2 categories: bronchodilator, which will help bronchodilate the airway, will help you to give relief. They are short acting, and the inhaled sort of anti-inflammatory or the corticosteroid drugs, which help to break the cycle. So in other words, the relievers and the preventers.
Right.
And it is the preventers which are the cornerstone of management, and that's the challenge, because you have to take the preventers when you're well as well. So as to be able to, and what on the other hand patients tend to do is to take a lot of relievers, take an aspirin puff or a short acting reliever and keep on taking it.
Right.
The dose increases, the effect decreases over
Right.
time. So that's,
And it's more short term, and preventers are much more long term in nature.
and we know that the weather changes 4 times a year in this part of the country, and therefore what I'd always tell, be prepared. Don't wait for yourself to get sick. So start on your preventers. The very fact, Holi, Diwali, rainy season, these are 3 main sort of peaks that you have.
Right.
So just don't wait, and use the preventers in a way that you are disease free for a longer duration.
Doctor, for these treatments, be it the preventers or the other type, are there any long-term effects of this treatment to asthma?
Yeah. So in terms of, I think there are 2 concerns. There are systemic side effects of the inhaled medications that we use. There are very little. Again, remember, think about a drug which is given in micrograms.
Right.
The inhalers have drugs which are given in micrograms through a device which delivers it directly to the lungs.
Right.
So the systemic, and that's just done to decrease the systemic absorption. We don't need these drugs in our head and our legs and our stomach, because we need them in the lungs. So, and inhalers are a very, very good way of delivering those drugs to these sites.
Right.
And they're given in very, very small quantity. And the systemic absorption is very little, and they've been generally seen to be very, very safe. And especially concern is in small kids, because there's a lot of asthma in the small kids. Whether it will hamper their growth, it will cause them other problems. Most of them, if given under medical supervision, are all fine.
Right. Doctor, there has been a significant rise in the respiratory disorders, and with lifestyle and the fast-paced, also the emotional part of it. What would be your advice to our viewers, how they should take care of themselves?
Yes, it's the lifestyle and the environment, both combined. I think it's a very, very toxic. We're going to see an exponential rise, and we are already seeing in the respiratory problems, and on top of it, the emotional stress. It's become the way of life, unfortunately. So my suggestion is, 1, stick to yoga. I think Indian way of life and Indian philosophy already had found an answer to it.
Right.
If you think about yoga, it is all about breathing and synchronizing your breathing, giving away your emotional stress, getting your lungs better. All the postures of yoga were actually looking at. So traditional Indian medicine or the wisdom had actually already found an answer to the problem that we are facing.
Right. Other than that, would you like to put some advice on, are they linked to obesity or something? Is it?
Most diseases are. Obesity is a big problem. It causes respiratory problems, decreases. It causes restriction, it causes increased work of the respiratory pump, and therefore you cannot just, the lungs are not directly involved, but they cannot take the air in, and therefore and there is a problem of obesity, hypoventilation. These are patients who will just hypoventilate, take small frequent breaths. So there is a problem of lifestyle, there is a problem of environment. Big things need to be done on the environment, but small things can be done by us. We still see people burning their waste, people using multiple vehicles. So small things on our individual fronts, legislative issues and administrative issues. I think all these things need to be done.
Doctor, thank you for your time. We really appreciate all the inputs you gave to our viewers. We would like to connect back with you again, trying to know about the research and what developments are taking place in the field.